to us about trauma and food addiction and eating disorders.
Yeah, it's been a focus of a lot of the work that we've done, especially trauma in the first 18 years. So one of the really hot topics in trauma, obviously most people are aware of adverse childhood experiences, but looking beyond just exposure to adverse childhood experiences, thinking about how these experiences, we call them experiences, not events, because events are just, incidents, isolated incidents, but the experience of the event is what makes something quote unquote traumatic. But a lot of data has emerged in the last 15 or so years showing that trauma, particularly in specific periods of development, can become biologically embedded. And what that means is that it can affect the immune system to produce more pro-inflammatory cytokines, as one example, increase inflammation over the lifespan, give people altered biomarkers. We know that trauma can affect genetic expression. So this is the whole emerging field of epigenetics. We know that especially, abuse and neglect can really alter the way people's genes are expressed, and oftentimes unfavorably. For example, with cortisol, we know that the HPA axis, which is responsible for the human stress response, and the output of cortisol is impaired in people that have trauma. We know that the dopamine system is impaired. We know that certain parts of the brain can be changed. For example, the hippocampus. We know that can be reduced, the volume of the hippocampus, which is responsible for memory, among other things. So, in summary, there's multiple pathways of biological embedding. We have a few others: changes in the gut microbiome, telomeres, the vagus nerve, the oxytocin system. I just named 8 total, maybe 9, right? There's so many pathways of biological embedding. And so what happens is people that have early life trauma have altered trajectories at a physiological level and of course at a social level. We know trauma affects people's ability to form deep social ties and to form positive relationships. But when it comes to biological embedding of adversity, these are risk factors for addictions, eating disorders, and of course, food addiction. So we've got a couple really strong studies showing that trauma affects food addiction in a meaningful way. And so I think it's important when we do food addiction recovery and sugar addiction recovery to be trauma informed. And what that looks like will vary, from person to person, but it's important to remember that nutrition interventions can be very triggering for people. And they can be very traumatizing for others, particularly if some people have had a lot of adverse food-related experiences. So if you grew up with parents that were body shaming, or parents that were using, not always just parents, but other people using food as a punishment or as a reward, people carry a lot of energy around food and around their weight. And so when we get people into recovery, it's important to not make assumptions about this is what your recovery has to look like. This is how it needs to be for you. We need to learn how to use weight neutral language, how to not, focus on too much like personal responsibility. Like if you want this bad enough, you'll do it. Some of that real sort of boot camp coaching stuff, it can be harmful to people and it can make people not feel like they're eligible for recovery. So trauma-informed nutrition really is about understanding the role of trauma in one's biology, in one's psychology, and then of course, in one's social health, and being able to understand people so we move them in the direction of recovery in a way that resonates with them based on their personal experience rather than some formulaic model.